Again, other examples about how we need to translate those outputs into meaningful outcomes, where you've got the Department of Health in England with a public health responsibility deal food network. By October 2014, the Food Network had between 6 and 90 signatories across 15 pledge issues, like lowering sodium, removing trans fat, but still it's all voluntary engagement. And then you've got the Partnership for a Healthier America that Hank mentioned. By 2013, they put out their second progress report that showed that 63 public and private sector partners made commitments, all voluntary, to address childhood obesity across 5 pledge issues: early childhood and child care, healthy food access, healthier choices in the marketplace, increasing PA, and engagement. But still, it's all voluntary. So we need to decide and determine how much can we expect from voluntary engagement only. We're going to definitely get tensions and conflicts between the public and the private and the civil society sectors because they all think differently, they all have different cultures, and I think that Hank did a nice job in underscoring that. The World Economic Forum earlier this year put out a very useful report to help us think through bottlenecks and enablers of these cultural clashes in these various disciplines and sectors. The bottlenecks are really driven by mistrust, fear of conflict of interest, lack of transparency, and lack of leadership, as well as organizational differences. And we need to start working on building trust and transparency, increasing partners to be better partners, acknowledging where there are differences and not as much common ground, increasing solution-oriented dialogues, and guiding trust building. So just to move on, the Beyond Business as Usual, this was a very good international example of trust building that happened in the UK between 2011 and 2013. And it ended up in a report called Beyond Business as Usual to move beyond a culture of short-termism toward a culture that values a sustainable food system. So if we can begin to think about reframing, as Shiriki said earlier in the panel too, in her comments, how do we reframe the situation? Perhaps we can find some common ground there that we hadn't thought of earlier. We also have other trust-building fora examples. In Australia, we've got the Food and Health Dialogue from 2009. They've been very effective at removing trans fat out of the food supply. We've got the IOM Roundtable on Obesity Solutions that Bill Dietz does in the US. Now, the holding to account. Remember I said that's the most difficult of the 4 steps. We've got industry self-regulation in the US, as well as other countries, versus an empowered enforcement. So we need to think about how we can get to an empowered enforcement. The UK has a really good example, the UK Groceries Code Adjudicator. It was appointed in 2013 by the government to ensure that large food retailers adhere to the Grocery Supply Code of Practice and treat their suppliers fairly within legal guidelines. I'm going to just whiz on because I want to show you a little later where that may be relevant to the US. Corporate practices that reduce trust, things like lobbying against sugar-sweetened beverage taxes. You've got certain organizations like the Center for Responsive Politics based in Washington, D.C., that actually will track how much money the food and beverage industry may be spending against certain types of more controversial legislation. And this is important because it's an example of duplicitous activities. So you can partner on the one hand, but if the companies or the industry sector is engaging in other activities that are not so good, how do we deal with that tension? And we need to be honest about it. We need to be transparent. So food reformulation, this is the first pillar in the Informaus model. We've got a lot of important activities going on, and you have to involve the food industry around reformulation and new product development. You have to. You can't just tell them what to do. And so IFBA, International Food and Beverage Alliance, has been a really good example of what's been happening along that. There are 11 companies now. They started as 8 companies in 2008, and they've made just some recent pledges to Margaret Chan saying they're going to up their responsibility for marketing to kids globally. So that's a good sign. We've got food reformulation, the Healthy Weight Commitment Foundation that Hank mentioned, which is a great example of voluntary engagement. The companies came forth and they achieved their outcomes early. Food labeling is more controversial. We've got 3 examples here. In the UK, we've got color-coded traffic light labeling, which has been in effect for a few years. And that's been actually very useful. That's an example of contextual labeling as opposed to informational labeling. People get a context and that helps them make quick decisions when they're in a food retail outlet. In Australia, earlier this year, the government actually posted a health star rating system, but it was pulled a few days after it was publicly posted, and some people say that there was some industry pressure behind it. The government said it had not been fully vetted. So just a few weeks ago, actually, the George Institute, which is part of Informus, they posted it with 80,000 products on their website. They're an NGO that's based at the University of Sydney in New South Wales. So basically, they put the government's rating system back on and say, okay, public, you can use it because the government may not ever post it again. We don't know what's happening. You also got the Keyhole as a Nordic nutrition label, and that's an important example. It just celebrated its 20th anniversary. There's 3 of the 5 Nordic countries, Denmark, Norway, and Sweden, that have been using the very positive green keyhole that shows healthier options. And I would just bring up, in the UK, the European Commission just initiated some litigation proceedings against the UK because of the traffic light labeling, saying it was negative. It was a negative type of food labeling, not positive. So that should be interesting to follow what happens, because you've got other countries like France that do want to do the color-coded traffic light labeling. Also, we've got healthy food retail and provision. This is important, and we do it to socially normalize healthy marketplace choices. So we've got 2 different interesting things happening internationally that might have some relevance here. Several months ago, Tesco banned sweets from checkouts in all stores. We don't have anything like that yet. We could probably get there. We also have the YMCA Victoria, in the state of Victoria in Australia, where all YMCAs said, we are not going to sell SSBs anymore. That's just it. So you've got that happening, and you have to say, well, how relevant is that, and could we actually accomplish that in the United States? And then healthy food promotion. I wanted to save this for last because not every food policy issue is going to result in a win-win-win to create a culture of health for children. So we need to find those issues where there is some common ground. But the sweet spot for the food industry, for food marketing to kids, it's a low bar, and it's got loopholes and gaps in voluntary self-regulatory programs. So it's not going to align with the higher bar of the public health and the advocacy community. And what I believe is that the government needs to appoint an independent adjudicator, kind of like in the UK for the food retail suppliers, to recognize the industry achievements, those companies that are doing well, to incentivize or penalize the disengaged and non-participating companies, and to support the underperforming companies. So we've got really to make a lot of progress here.